Howdy y'all, in today's video we're going to talk about a condition that so many people, millions of people suffer from: constipation. Oh my gosh, this is probably the most common complaint I get in my office. I'm going to break down to you how a Mayo Clinic GI doctor approaches constipation so you can find out what the heck is going on. We're going to go through a real life example of a patient of mine. We'll talk about some of the common myths when it comes to constipation. We'll go into the science of why it happens. And at the very end of the video, I'll go over some simple, effective tips that I recommend as a Mayo Clinic trained GI doctor to get you going and get you flowing. If you've had issues with constipation, this video is for you guys. Let's talk about poop. Howdy y'all, Dr. Islam here, board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with all sorts of constipation issues. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And come see us today where you can make an appointment. Visit us at lubbockgastro.com for more information. We can see you today without an referral. And don't forget to subscribe to my newsletter where you can get up-to-date information on what you need to help out when it comes to your bowel issues. Let's talk about Sarah, my patient. Sarah is a 52-year-old female who is an office executive who is having issues with constipation. And she has a high-stress job. Now, trust me, I know. I have my own office manager. Listen, it's stressful to work for a doctor. Sarah doesn't work for a doctor, but she does work in an executive clinic. Now, she's been having issues with constipation pretty much her whole life. It's gotten to a point now where she's having difficulty with pain. It's affecting her quality of life and affecting her social life as well. She complains of difficulty using the restroom, straining, pushing for a long time. She sits on the toilet and nothing comes out. And when something does come out, it's small little pebbles. She's like, oh my gosh, all that effort just for that. She also complains of left lower quadrant pain with some bloating and distension, and it's affecting her quality of life, including her life with her husband as well. Now, she hasn't changed her routine lately, but she has noticed she's had a lot more stress in life. And because of that, she's not done the things that she normally does. She hasn't exercised as much. She's been drinking more coffee, drinking less water, and eating a lot more fast food than normal. But even when she was doing things normally, she was still having issues using the restroom. Now, like a lot of people, she doesn't know exactly what's going on, what changed, but she knows something isn't right. So when I saw her, we did an initial evaluation. I did an abdominal exam. I can feel some pain on the left lower side. And surprising to her, I actually did a rectal exam chaperone. And on the rectal exam, I could assess a couple different things. Number one, I could feel some hemorrhoids that are there. I could also feel what's called a fissure, which is a tear in the rectum as well. And I actually had her pretend she's having a bowel movement. Now, she freaked out a little bit, but I told her I need to really understand what's going on in your rectum when you have a bowel movement. So on the rectal exam, when she had a bowel movement, I could feel initially the rectum tone was very, very tight. And when she was pretending to have a bowel movement, I could see that my muscle actually contracted into the rectum. And then after that, I was like, aha, I know what's going on. I know what to do. Yeah, I didn't really do that. But what would I do in this case? So what do people think constipation is? So like Sarah, she was obsessed with the number. Doc, I'm only going one time every 5 days. That number, how often should I be going? And this is the most common question I get when it comes to constipation. Dr. Islam, how often should I go? Dr. Islam, I'm going one time a day. Dr. Islam, I'm going once a week. I'm like, dude, relax. The number doesn't matter. I don't care how often you go, and no doctor cares how often you go. What matters to me is how do you feel when you're using the restroom, when you're having a bowel movement. So the medical definition of constipation is less than 3 times per week. I don't give a flip about that number. What matters to me is how you feel when you go. So even if you go every single day and you're feeling you have incomplete evacuation, you're straining, you're pushing, you're just doing what you can and nothing's coming out, you're constipated, even though you're going every single day. Or if you're going once every 5 days, but you feel fine, nothing's going on, you don't feel bloated or distended, you feel okay, then I don't even worry about that. That's not a big deal. So more important for me is not the number, but how do you feel? Do you strain? Do you push? Do you feel like you have incomplete evacuation? Do you have fissures? Do you have hemorrhoids? Are you not having a good bowel movement? Are you like, oh my gosh, I hate using the restroom because nothing comes out, I don't feel good, I don't feel like I'm emptying everything out, then voila, you have constipation. That's all I care about. So don't obsess about the number. And so many people obsess about the number. And it's not about going every single day. No one cares. I don't care. That's not a normal. It doesn't matter to me. What matters to me is what's normal for you, but more importantly, how do you feel? So what exactly is constipation? More than just the number, it's how you feel. Do you have difficulty evacuating? Do you strain when you have a bowel movement? Do you empty everything out? Do you pass hard and lumpy stools? And in some cases, do you actually have to manually disimpact yourself whenever you're having a bowel movement? And do you have other associated symptoms? Bloating, left lower quadrant pain, hemorrhoids, fissures, rectal pain? Do you have difficulty when it comes to sexual encounters? Does it hurt when you have a sexual encounter with your significant other? Now in Sarah's case, yes, she checked all these boxes. So yeah, she had constipation. 100% she did. And I didn't use this based on the number. I did this based on the symptoms that she was feeling. So what are common causes of constipation? So I want to stress, in this part, I really want to kind of really do a deep dive because I think so many people use the wrong approach. So the first thing we try to do is, are there external causes of constipation? So for example, medications. Medications commonly cause constipation. Even medications they use for everyday use, whether it's blood pressure medications, or maybe the GLP-1s, if you look on the warnings, constipation is a side effect. And so look at the medications that you're on and seeing, is this a medication that can cause constipation? Because we may need to adjust this. Common ones include the GLP-1s, opiates, blood pressure medications, iron supplementation. These are things that are easily fixable and treatable by just adjusting medications. But let's talk about exactly the approach when it comes to constipation, because a lot of my patients stress and try to focus on lifestyle changes first. And unfortunately, this is not correct. No, it's not. I'm not saying you shouldn't focus on lifestyle at all, but focusing on this first is not the best approach. We got to figure out, why do you have constipation? So when it comes to constipation, basically comes down to two main reasons. It's either a colon problem or it's a butt problem. B-U-T-T, yes, a rectum or a beehole problem. That's exactly right. And we got to figure out which one it is. So how do we figure this out? So sometimes we can use our history to figure this out. So if you come to me complaining of incomplete evacuation, straining, sitting on the toilet for a long time, pushing things out, that makes me think it's a butthole problem. We got to address that. But commonly, my patients who have colon issues complain the same thing as well. So it gets confusing for me as a doctor, like which one it really is, because the treatments for different ones are very, very different. How we treat the colon problem is very different than how we treat the butthole problem. We gotta figure out which one it is. So I like to use objective testing because I like to use testing to find out exactly what's going on. I hate guessing. There are a couple tests that I do when it comes to constipation. So number one, we'll get routine blood work. We'll check a CBC, make sure you're not anemic. I'll check your thyroid level to make sure you're not hypothyroid. I may check some calcium levels and some other levels just to make sure nothing else is going on. In some instances, I may get a KUB. If I'm not sure if we're having constipation, on that KUB, which is an x-ray, I can see if there's a large amount of stool burden that's there. So for example, if you're coming to see me and you say, hey, Dr. Islam, I go every day, but I don't feel very good. I'm not sure if I'm emptying everything out. In that case, if I'm not sure if you have constipation, I'll get an x-ray or a KUB to see if there's a lot of stool that's there. Often there is. But the two tests that allow me to figure out, is it a colon problem or is it a butthole problem, includes a colonoscopy and what's called an anal rectal manometry. Let's figure this out. So a colonoscopy is a test in which we can take a look inside the colon to see what's going on. And with that, I can check for things like polyps, ulcers, colitis, inflammation. If you're over 45, we're gonna recommend this. And if you're under 45, I may wanna consider this as well because we see things in there that may be important for us to find out what's going on. But then we do what's called an anal rectal manometry test. This is an important test. This is a test to see exactly how well the rectum muscles are doing. We can check to see if the rectum is the root cause of what's going on. And these two tests allow me to figure out, is it a colon problem or is it a butthole problem? If it's a colon problem, we want to focus on addressing the colon. That includes giving you laxatives, medications, things that get you going and flowing. Because if it's a colon problem, often it's either a problem with the contraction of the colon, the water of the colon, or the mechanism of the colon. This is where medical therapy will help. If it's a butthole problem, there's no amount of medications that's going to open up that butthole. That's it. The best analogy I have is like having a toothpaste with a cap on. No matter how much laxatives you give, no matter how much you contract the colon, if the rectum muscles are tight or if the cap is on, nothing is going to work. So we got to figure out what is going on. And that anal rectal manometry test allows me to see which one it is. So with that, it sounds weird. We put a balloon up your bottom, we inflate the balloon, and we check the pressures of the rectum. With that, I can see the pressures at rest. I can see the pressures whenever you're coughing. I can see the pressures whenever you're having a simulation of the bowel movement. And I can check to see how long it takes for that balloon to expel from your rectum. This will allow me to figure out, is it a colon problem or if it's a butthole problem? If it's normal and your colonoscopy is normal, well then it's a colon problem. And at that point in time, we got to get you going and flowing, whether it's laxatives, supplements, medical therapies. We got to get things going and flowing. If it's a butthole problem, once again, there's no amount of laxatives that it's going to open up the butthole. We have to focus on that. So in Sarah's case, that's what I did. We did a colonoscopy and we did an anal rectal manometry test. And so in this case, for Sarah, let's say scenario 1, we ended up finding out it's a colon problem. The colonoscopy is normal, and then the anal rectal manometry test was normal as well. Well, in that case, we got to get Sarah going and flowing. When it comes to constipation, so many of my patients focus on lifestyle changes. Now, this is important, but it is not the first thing we need to do. I want you to stress this. I want you to have the analogy of a train. If a train is sitting on the track, it's going to take a lot of force to get that train going and flowing. It's got to, you gotta push that train to actually initially allow it to start moving on that track. It's the exact same thing in your colon. If you have stool that's been sitting there for days, it's gonna take a lot of force and effort to get that stool out. And this is why it's very important. Initially, we give you things to get you going, whether it's laxatives, whether it's magnesium, whether it's castor oil, whether it's L-glutamine, whether it's medical therapy, whether it's lactulose, all these other medications that are out there in the market, whether it's medical therapy, it doesn't matter. We have to get you going and flowing. And I want you to focus on this first. So many patients focus on lifestyle changes first. That's not going to give you the power to move things along. It will help, but don't focus on first. We have to get you going and flowing. Now, once the train is going, then we can add in lifestyle changes, whether it's less stress, walking, adding in coffee, adding in some food, adding fiber, more fruits, more vegetables, mangoes, pears, dragon fruit, fiber. That will keep the train going, but it will not work initially. Now let's talk about fiber when it comes to constipation. So many doctors recommend, fiber. Yes, fiber works, but it does not work if you're not going and flowing first. Because when you add in fiber and there's still issues when it comes to constipation, you still have stool that's there, guess what the fiber is going to do? It's going to make you bloated, more distended, more gas. It can actually make the constipation worse. So when it comes to fiber, number 1, make sure you're in the process of getting things going and flowing. Number 2, go low and go slow. Fiber can act as a dual-edged sword, and so you want to use this on a low dose and then slowly titrate it up over the next couple of weeks until we can get you to the recommended 25 to 40 grams of fiber per day. And some people, it may be more than just adding fibrous foods. You actually may need to add in synthetic fiber so you don't have the side effect of bloating, and that's okay. But go low and go slow. Once the train is going, and then you've added lifestyle changes, then we have the option of maybe backing off of medical therapy. We can see how you do. And if we can get you off medications, that's great. Now, it may take a couple of months because your body has to get used to a new normal. But once we've done that, then we can back off medications. Now, a common scenario my patients ask me is, hey, Dr. Islam, I feel great. I'm going and flowing, but I try to get off medications and I cannot seem to get off of them. I have to stay on them. And I tell you, that's okay. It's not a big deal. Some people need medical therapy, and it's not a big deal. I don't want you to think you're a failure, or all of a sudden you're dependent, or something's wrong. Some people need meds. It's not a big deal. Just like some people need to be on medications for diabetes. It's not a big deal. You can do everything right, and sometimes that's just the way your body is, and that's okay. Not a big deal. It's not a mark on you. It doesn't mean anything's wrong. It just happens to be the case. But we have the option to get you off the medications. That's perfectly fine. Now, let's say it's another scenario where the rectal muscles are too tight. Let's say that Sarah had what's called pelvic floor dysfunction. Well, in this case, I'm not going to recommend more laxatives, though it may help out in some individuals. I may not recommend dietary changes, though it may help out. I'm going to focus on getting that rectum muscle opened up. And the best way to do this is called pelvic floor therapy. When someone has pelvic floor dysfunction, in which the rectum muscles are so tight, there's no amount of medications that's going to open up the rectum. So just like I hurt my shoulder and I had to go through physical therapy, it's the exact same thing in the rectum muscles. You go through pelvic floor therapy to teach you and to teach your rectum. Yes, your rectum, has a mind how to use the restroom appropriately. And what we come to find out when you look at the studies is that those individuals who have pelvic floor dysfunction, they abnormally learn what is going on. And so they get used to a normal in which the rectum muscles are tight, they're straining, and as a consequence for that, the rectum can become bigger. They can develop what's called megarectum, and also as a consequence of that, they can develop rectoceles, cystoceles, pouches that will make it more difficult for things to go through and have better going and have better flowing. And so teaching you how to use the restroom through pelvic floor therapy is the treatment of choice. Now, on average, it's about 4 or 5 sessions that you need. And the other issue is that, it's sometimes hard to find a good pelvic floor therapist because they're in high demand. But that's okay, because we know exactly what's going on. And just like in constipation, it's taking you a long time to have a bowel movement. Just like in pelvic floor therapy, it may take a while to get you into a good therapist, but that's okay. It's not a big deal. So in this case, in Sarah in particular, when I did her exam, I could feel the rectal muscles are so tight. I could feel the hemorrhoids. So we addressed that. In addition, in this case, I also fixed up her hemorrhoids as well, because fixing the hemorrhoids can make some people have a better option and get them feeling better in terms of having issues when it comes to the rectal muscles as well. So what can you do when it comes to constipation? So here's what I recommend to you. If Sarah's story sounds like you, I'd recommend for you to actually recommend for yourself to get a colonoscopy and get anal rectal manometry. I do this typically on most of my constipation patients because I want to find out exactly what's going on, because I don't like being confused sometimes on the history or kind of other things that are going on. I want to get objective evidence. And I would ask you or ask your doctor to say, hey, can you refer me to somebody who can do anal rectal manometry to find out what's going on? And in that case, we can at least delve down to find out what type of constipation that you have. Now, there are other things you can do to help you go and help you flow. So fibro works, but once again, you have to kind of watch out when it comes to a dual-edged sword when it comes to fiber. Go low, go slow, use synthetic fiber, and also make sure you're using it in the process of getting you going and flowing. Number 2, develop a good bowel routine. Sitting on the toilet, watching YouTube videos, TikTok or whatever, you're scrolling through social media is not the way that your phone's supposed to be used. Number 1, that's disgusting. I mean, why are you taking your phone to the restroom? But number 2, you develop the habit of taking your time when you use the restroom. My recommendation, 2 minutes, get out of there. If you're not going, just get on out of there. That way you're not training your body to just sit there. Number 3, if you have issues with pain, hemorrhoids, get them fixed. Come see us. It's easy. It's an easy procedure. This may help out when it comes to rectum issues as well. Number 4, get going, get moving. Exercise makes a big difference when it comes to bowel habits. Your body likes to exercise. Your rectum likes to exercise. I like exercise. Everyone should. Exercise is a cornerstone for constipation. So if you're not moving and going, get moving. And then lastly, create a bowel routine. Your body thrives on rhythm. Your bowels thrive on rhythm. And so create a routine that's unique to you. I'll tell you my routine. I get up, have my coffee, wait about 30 minutes, boom, everything comes out. I feel great. That's my routine, and I stick to it. I want you to stick to a routine as well. Even on the weekends, I stick to the same routine. If you stick to a routine, your body will get used to it, and when it gets used to it, you'll start to feel better as well. So constipation isn't just inconvenient. It's your body's way of telling you something, hey, something's off, something's different. You need to get this checked out. The good news, with the right strategies and more importantly with the right testing, we can literally find out the root cause, because once we know the root cause, then we can find out what we can do to get you feeling better. But here's the thing, information is only useful if you use it. So here's my challenge to you. Take one tip from this video, whether it's seeing a doctor, whether it's asking for anal rectal manometry testing, whether it's going for a walk for exercise, or establishing a bowel routine. Let me know down below and start today. One small change can get the process of get you going and get you flowing, get you feeling better. Now, if this video helped you understand your body a little bit better, do me a favor, hit that like button. It helps more people to see this video. Number 2, subscribe to my channel for weekly gut health videos and simple wellness strategies. Number 3, comment below on your experience, what worked for you, what questions you have, what other videos you want me to do when it comes to constipation. And number 4, come see us. I mean, literally, we're here, bro. We can help you out. We can find out what's going on. We can get down to the root cause and get you feeling better. Thanks for being here. Take care of yourself and your gut. I look forward to seeing you guys on future videos.